Great is the Lord. Thank you, choir. Thank you very much. Thank you, Cindy. Before I read the scripture, I'm trying to decide where to read this for you, and I guess I figured now is the right spot. It's a brief announcement that our conference sent out, and it is a way of serving. And I'll just read the headline for you. Merrill Church at the heart of efforts to aid North Carolina farmers. I know both of our churches come from strong farming communities, with farming still being a big part of who we are. A member of St. Stephen's UCC in Merrill is at the center of an effort to ship donated hay to farmers in a region of North Carolina that was devastated 2 weeks ago by Hurricane Helene. Todd Frederick, owner of a manufacturing company in Merrill, got involved after learning from a friend who operates a dairy and cattle farm near Asheville, North Carolina, that Helene had destroyed crops in the area. The friend and his fellow farmers needed hay to sustain their livestock. St. Stephen's posted a plea for donated hay to social media, and Todd went to work on the logistics, arranging for trucks to haul it in to the affected farmers. The response? It's been a while, said St. Stephen's pastor, the Reverend Mike Southcombe. Thousands of hay bales have been donated already, mostly from Wisconsin. Though farmers as far away as Texas, Kansas, Arkansas, and New York have contributed. St. Stephen's has raised around $13,000 to pay to transport the hay, though trucking companies have also offered time and trucks to the effort. The congregation is planning a fundraising dinner later in October. The Wisconsin Conference donated $1,500 to the effort. The generation of these farmers is something to be celebrated, Mike said. It does not surprise me, but it will always inspire and humble me. I wanted to share that because we are indeed a farming community at heart, and it's humbling indeed, not necessarily amazing, but humbling indeed to see how our farmers continue to come to the aid of those in need, and not always just within our community, but here several states away, helping other farmers. What a blessing. The scripture that I want to share with you this morning is one of the main reasons I believe that we serve in mission and that we serve those in need. Not only because Jesus tells us to, although that's compelling in and of itself, but we do so because of this commandment that he gives to us. Jesus tells us in John 13, verse 34, "A new commandment I give to you, that you love one another just as I have loved you. You also are to love one another." We do what we do out of love. Love of Jesus, love of one another. Love of one another even as Jesus has loved us. I'd like to invite Kristen Blanchard Stearns here. Now, she has been a nonprofit leader in our community for decades. She previously served as the executive director of Sheboygan County Interfaith Organization, SCIO, and the Director of Quality Improvement Community Services Supervisor for Catholic Charities of Archdiocese of Milwaukee. She's been on the board of directors for Sheboygan County Chamber of Commerce and was appointed by Mayor Ryan Sorensen to the City of Sheboygan's Board of Police and Fire Commissioners. She has volunteered or is still volunteering through Rotary, the United Way of Sheboygan County, as well as other organizations. She's held the position of CEO of Lakeshore Community Healthcare since July of 2013. And we are delighted to have you here today.
Thank you. Thank you, everyone. That was a lot. I think sometimes when you read that stuff, I forget how much I've done. But I've done nonprofit work, I always say 30 years. I don't look like it though, right? So just nod and say yes. No. So I do realize that I am between you and a ham dinner. So I will try to be mindful of time today. But I just want to first, driving in was just such a beautiful drive for me today, and I appreciate being here with you all today to be your mission moment, to talk about Lakeshore Community Healthcare and the work we do, and why the work is so important in Manitowoc and Sheboygan counties. But a little bit about the health in our state, right? The health in our country. Right now in Manitowoc County, there are about 12,000 individuals who fall at or below 200% of the federal poverty level who struggle to get access to care. And we think about healthcare in a lot of different ways, and at Lakeshore Community Healthcare, we think about it as a really a holistic model. So we come out of an endeavor from the federal government that started in the 60s, the War on Poverty, Johnson's era, and community health centers were created really to support that access to care. And it doesn't matter what your income level was at that point in time. It was really, how do we get access to care to people who need it, from rural to urban, from socioeconomic to other health equity. I love that you talk about equity in your opening, but other equitable issues out there. And so back in the 60s, Dr. Jack Geiger, he went to Congress and said, hey, I think I might have a solution on how people can access healthcare differently, different from how we do it with the big hospital systems and clinics and those things, but how we can really give people access. And so he helped Congress get some money to grant an organization in the inner city of Boston, Massachusetts, and then a little rural community outside of Biloxi, Mississippi. And they started this movement, and we call it a movement. We really believe in this movement, again, back in 1960. Today, Lakeshore is one of 1,400 health centers across the country. And so we are in rural and urban. We're in all different parts of the state of Wisconsin. Lakeshore is one of 19 community health centers here in the state of Wisconsin. And all of us have the same mission. Though a little bit different, we say it differently, we might emphasize different pieces of it, but it's all the same, and that is, we want to provide access to care to everybody in our community and be responsive of those needs by eliminating barriers to care. And so at Lakeshore Community Healthcare, and so if you're in Manitowoc, we're on Calumet Avenue. If you're from here, it's the old Red Owl building. Everybody knows the Red Owl, right? And in Sheboygan County, we're actually, we've repurposed the former American Orthodontics building, their headquarters, back in the day on Salmon Avenue. And so we create this space for access to care for all the people in our counties that we serve. And we do that through providing primary medical care. So as you go to your doctors, we want to make sure that people who can't access care anywhere else have access to that care. Again, primary care, I think about, right, that preventative and chronic disease management, all of the things that we do, women's health, we really encompass all of that within the care we provide. We do dental care, oral health care, full restorative oral health care, so we meet with patients, we are able to clean teeth and fix teeth and make folks have bright smiles again, which is really wonderful. We also provide behavioral health and make sure that people have access to mental health care, chiropractic care, because we know that our bodies oftentimes need more than just our physical health being looked at, but that alternative health care is very important, especially in communities in which we do lots of manufacturing and heavy lifting and farming, all of those things. We want to make sure we look at that the whole body. And then also having some pharmacy and supportive services. And so let me talk about how we do this and why this is so important. So last year, Lakeshore Community Healthcare served over 13,000 individuals between Sheboygan and Manitowoc counties. 95% of those individuals were at or below 200% of the federal poverty level. We were able to provide primary medical care to over 3,000 individuals between those two communities. So primary care is a little different, right? There's access to primary care, but the access point, the piece that really is needed, is that access to oral health care. Almost 70% of the patients that we serve don't have a dental home when they come in to see us. And most of them haven't had dental care for years. And again, we think about, I always think about like our teeth, right? How close our teeth are to what two organs, our heart and our brain. And if we are not taking care of our oral health, the fact of the matter is that it can affect all of our health, right? Again, our wonderful healthcare system has separated those in insurance statuses and what we do, but we know that the important piece is that we need both. And then, of course, it's the behavioral health. So when people come into our clinic, we assess them on all the things, from their physical health to their mental health to their oral health. And even in our dental clinic, we've just started to look at suicide risk and make sure that patients coming in our door are getting access to the things that they need. So we started out 14 years ago, so I've been doing this 13 years, but it's 14 years that we started this venture. And I'm going to talk about why we're even here, right? Why is Lakeshore even in our communities? We have Holy Family, and we have Aurora and Sheboygan, we have St. Nick's, and we got Aurora, and they're doing all the work, and they're amazing and great partners of ours. We can't do it without them. And yet, there's still this gap in need. So back in 2006 is when this, I call it an adventure, it feels like an adventure to us, our journey started. And if you don't know, your hospital systems and public health, they have to do this community health needs assessment every couple of years. If you looked online or in newspapers, you'll actually see that they're doing one right now in Manitowoc County. We're just finishing up asking the community, what are your needs? And that's what we did back in 2006. And the number one need, anybody want to guess what the number one need was for healthcare in 2006? I'm an interactive person here, so no interaction. Everybody's like, please. The ham dinner is coming, I know. All right, so the number one need was oral health, access to oral health. People couldn't get access to oral health. If you were uninsured, and again, employer benefits a lot are health, but they're not dental. So if you were uninsured for dental care, you had to pay cash for that. Or if you were on Medicaid, so this government state insurance, or Medicare, for those of you on Medicare, access to oral health care just wasn't there. You couldn't get to a dentist unless you were going to pay cash for it. And so that's how we started. And so today, we go to every school in Manitowoc County. They did a little grant, and they got this program called Healthy Keep Health Communities, and we go to every school in Manitowoc County. And we provide oral health care to any kiddo who needs it and wants it, who doesn't have a dentist outside of what we can provide. And we go in with a dentist and a hygienist and a dental assistant, and we go and we provide kids access to full care, dental care. And we've been doing that since 2007. And when we moved forward and thought we can just do so much more, we wrote for the grant to become a federally qualified health center, and that's what we got in 2012. And we've been doing that ever since, and really building out again those other services. So let's talk a little bit more about our school program. So besides being in the schools and providing oral health care, as we move forward, the needs changed, right? So we're helping with oral health care, we're doing a little medical, we have behavioral health, but the number one need this last cycle, and my guess is it'll be this cycle again, is access to mental health and behavioral health care. The struggle of isolation and loneliness and people feeling disconnected is real. And COVID just built that. Like it moved that faster than what we realized it was going to do. And because of that, we've really made efforts to provide mental health care to the kids in Manitowoc Public School System and in Sheboygan Public School System, Howards Grove, Kohler, and now Random Lake. And the important thing is that kids have access to those services that need it, so that they can get this coping skills and all the things that they need to, again, rise above what's going on in their lives and be able to cope with adverse situations. We all have them, and to do that. And then again, providing those services again within the health center directly. We love providing care to anybody in the community. Any of you can come to Lakeshore Community Healthcare and get your care with us. You don't have to be uninsured, you don't have to be underinsured, but we're just able to provide services differently for folks who are. If you fall at or below 200% of the federal poverty level, we're able to provide some discounted care for individuals so that everybody, again, has access to care. We don't want insurance status or income, financial, to be a barrier for people to get access to care. And so that really is important to us. So the donations that come in the door and the support of our community really goes to us providing and being able to continue to provide that care to folks who are at or below 200% of the federal poverty level, to give them those discounts, to provide that additional support to them so that they can get the access to care needed, so that they can be healthy and happy individuals within our community. And so that is the work that we do at Lakeshore. I have brochures in the back because I believe everybody needs health care at some point in time and access to health care. So I have brochures in the back, and of course a little gift of it is floss, a little tube that hooks on your keychain so that you floss all the time and remember us. But again, I just thank you for having me and appreciate your ability to listen to the work that we do, and hopefully you can share this with somebody in need in the future, or if you could use access to care, we're here to serve you. So thank you very much.